I think the key is everyone continuing to work together and to make it a community-based issue. Problems are best solved at the local level, and by working with communities around the world, particularly those that are most subject to the impact of polio. I think we're going to do that, and Rotary is going to be there at the end. Everyone else is going to be there at the end, and we're going to be pretty happy about it. But mainly, the people are going to be happy are the families and the children who no longer have to worry about this disease.
Jalaa, what would you say is the one key?
I think for polio and for everything else, it is the human-centered approach, especially the frontline workers. I think we all, in our daily interactions, whether at work or at home, everything that impacts us is our interactions with people. And so for those people in the communities who are receiving services, really focusing on the frontline workers, making sure they're paid, they're trained, they're motivated, they have the security and access that they need, I think that will be our bridge for global health as well.
Jillian, what would you?
So I think what we're hearing here is, the importance of meeting people where they are, understanding their needs, whether they're frontline workers, whether they're parents making decisions. And so I'm going to say that actually we need to understand that perspective. So I'm going to make a plug for research in my moment, which is to say, you know what? We have to have a dynamic evidence base to make changes in a dynamic world. And we need to have capacity to do that globally, not just at major institutions. And we need to think about how we can support what's going to come next. Because the next thing is not just polio. We got to be thinking about where polio leads, broader immunization, broader health services to children.
And Senator, what about you in Pakistan? What do you think is the one key thing to get to a polio-free world?
Our experience really has taught us that this last mile to eradication is really the most difficult to cover. And thus, everything that's been said so far by the participants makes a lot of sense. But if you ask me, fundamentally, I think it boils down to a question of political will. Political will not only in the remaining polio endemic countries only, but globally across the entire partnership here. So I think we really have to stay the course. We have to work hard, but stay focused and composed. In my country, polio eradication is our national imperative. It enjoys a broad political and popular support. My Prime Minister has made a commitment to a polio-free world for our current and future generations. And we absolutely have no intention of letting them and the children of the world down.